live stream the meeting.
And will it tell you when it's
now?
We are now live.
It seems it has captured us in the lead up, even before being live, but that's okay.
Every time I watch a Facebook Live, there's always a minute of the speakers messing around with the technology.
Good evening, everyone. It's wonderful to have you with us. I'm here with Dr. Rachel this evening to share with us on schemas. How are you, Dr. Rachel? How are you tonight?
I am good, Dr. Alexis. How are you going?
I was thinking about that. I might go by Master Lex. Do you think I can claim the name?
I'll call you whatever you want to be called.
Excellent. Yeah. And we're here to talk about schemas. Now, some listeners may not have heard the word schema. So for those listeners, would you like to share with us what a schema actually is, please?
Sure, yeah. And clearly some of our followers have heard about what schemas are, because we had a couple of comments on this morning's post asking for suggestions. And this is why we're talking about this topic, right? Saying, can you please talk about schemas? Someone asked if we could talk about self-sabotage, which actually links well with schemas. And I had another question through private message, and the person said I could read out their question, which I'll do soon. Also interested in schemas. So some people do, but for the people who don't know this word schema, psychology stole this word, like it has done from lots of other disciplines. You know, we like to steal our words. A schema is simply an organizational system. A schema is a system for organizing, in the case of psychology, our thoughts, our ideas, our beliefs, and our experiences. So what does that mean in everyday language? I guess our schemas, particularly the ones that become problematic, they're not all problematic, but are really our beliefs, kind of like our computer's operating system, our beliefs, our assumptions, our expectations about the world and about ourselves and about relationships. And the theory is that our schemas develop in the first sort of 12 to 20 years of our life as an adaptation or a response to our experiences, in particular, not getting our needs met. So when we're young people, we bring some pretty core needs into the world, like being supported, being encouraged, acceptance, self-worth, trust, protection and safety, and many other needs that children and teenagers have, and which get more complicated as they get older. Now, most of us experienced not getting complete unconditional acceptance and support and love. And so depending on our genetic personality traits and our environmental kind of learning experiences, most of us develop one or more schemas as a way of kind of thinking about ourselves and relationships. And these schemas, in some theories, there's 12, 16, it doesn't really matter. These schemas go by kind of not always very nice names, like mistrust schema or abandonment schema, unrelenting standards schema, or self-sacrificing or approval-seeking schemas. And most of us have, some fears or tendencies, perhaps around, approval-seeking or self-sacrificing, which means putting other people's needs before our own. Or unrelenting standards, which means, like perfectionism. It's just a fancy name for perfectionism. Perhaps we've got a really strong fear of abandonment or difficulty trusting people. And so, because of our earlier experiences, we reach adulthood with these schemas, these beliefs and assumptions, and they affect our relationships and they affect our lives. And I'll tell you what else they do. There's a couple of things I've noted here about what do our schemas do. They influence what we pay attention to, because we all have this selective attention. So we look for things that fit with our schemas. They can affect how we learn, because we tend to learn things that readily fit with our existing schemas. They help us simplify the world. So they make us vulnerable to stereotyping. But they do some good things. They help us process quickly, think quickly, help us, filter out information, but they also make it quite hard for us to change. That's what I wanted to say about schemas.
So what's occurring to me as you're talking is they're almost like our glasses, like the way that we see the world, and the way that we're interacting, the way that we're learning, and the biases that we're filtering all the time.
Yes.
That is fascinating.
Exactly. And they're very much mostly unconscious until we make them conscious.
Interesting too that you've acknowledged that they have these labels, because I personally have an aversion to labels. And I remember the first time a psychologist suggested my schema, I was quite taken aback, and it took a long time to actually come to terms with it, to put my ego aside and accept that, there was certainly some truth in what she had to say.
Do you remember which one she suggested that you might?
Oh, you are so straight to the jugular. Yes, I believe at the time it was dependence.
Mm-hmm.
Yeah, which I can see. I can absolutely see.
Mm-hmm.
So,
I'll tell you my schemas if you tell me your schema.
Okay, what's your dominant schema, Rachel?
Well, every time I've done the Young Schema Test questionnaire, I come up high on unrelenting standards, which is not uncommon for professional women, trying to be all things to all people all the time.
Yep.
I think some of our listeners could probably relate to that one. I have also come up high on self-sacrificing schema. Putting other people's needs ahead of my own. Subjugation schema, which is just more about downplaying your own needs, not necessarily elevating others, but ignoring your own needs. And when I first did it at 22, I'm ashamed to say, not really ashamed, but embarrassed to say that I came up high on the entitlement schema, which was kind of like a belief that the rules didn't really apply to me all the time. And looking at my own development, I can sort of see how as a young adult, I did kind of, I was a bit of a rebellious teenager. So I see how I had that schema as well. So we've all got our schemas, and there's no shame, but we can change them as well.
I just wonder if there's a way of framing them positively, but that is for another day. For today, I'm really interested in your understanding from a needs-based perspective, because people can read about schemas, they can probably identify with one or two. They can probably have a look at your blog post, which gives examples of how they manifest.
Yes.
But I think what you bring uniquely to listeners is the needs-based practices. So,
well, I mean, I would like to actually quickly reframe schemas, because these are very intelligent and creative adaptations to our earlier unmet needs. And so I always honor coping strategies and creative adaptations that human beings make consciously and unconsciously. But then, once I, help people, and this is what I do in my job, learn to identify, connect with, and express their needs, and slow down and practice mindfulness, which, I know you're very good at teaching people to do, Alexis, then they can do what we call bypassing their schemas. So although they've got this automatic impulse to react in a certain way, say be a people pleaser or assume something negative about themselves, if they slow down, if they've learned some mindfulness and self-regulation practices, and then they can identify their needs and honor and respect their own core needs, and then they can take different action and bypass their old schema. So, learning about our needs is crucial to healing our schemas.
So you're saying that the ability to slow down prevents us from reacting, or helps us to avoid reacting unconsciously, as we may be doing according to our schemas. Yes. I had a client say that very thing this morning.
Oh, tell me.
Slowing down.
Yes.
She said she was, her boss was giving her a performance review, which was basically of his own accord. And she was able to recognize that what he was bringing to her was actually not the truth. But her initial reaction was to defend herself. And she went to compose the email. She said slowing down enabled her to break the cycle of reactivity and then to get more creative with her resources in her response. She was brilliant. She absolutely nailed it.
Yeah, that's perfect. Yeah, so we definitely need to become conscious. So mindfulness practice is all about becoming more conscious. And that's brilliant that she brought that awareness and then she had more choice by the sounds of it. You mentioned the blog post, Alexis. So I thought we might share that in the comments, but I might just briefly touch on those 3 strategy or the 3 responses that you've read the post, haven't you? That we can have. Yeah. So in the blog post, I mentioned a theoretical person, John, who's got what we call a defectiveness schema. The language in schema therapy I don't like because it's quite pathologizing. But anyway, we'll hold the words lightly, hold it all loosely. He has a defectiveness schema, which means he believes he's unlovable and unlikable. Now, in the, so what we'd maybe call low self-esteem. So in the blog post, I mentioned that he can do one of 3 things. He can avoid relationships or situations that trigger his painful beliefs. Or he can surrender. So just give in and just believe that, he's worthless, and just give in and give up, and he might get depression. Or he can overcompensate and try really hard to get people to like him, or try and manipulate things so that he looks like a nice guy and a good guy. So these are called avoiding, surrendering, and overcompensating. And all of them end up sabotaging ourselves because we're not connected to our needs. We don't honor our own needs. And, we don't get our needs met if we use these strategies of surrender, avoidance, or compensation. And so this is just one framework, one way of thinking about what we do when we're not connected to our needs, and our beliefs drive, our lives. But it is a useful framework because it just helps us become conscious of what we're doing, so that, like your client this morning, we have more choice and we're less reactive.
Yes, okay. So it helps us to fulfill our deeper needs, to live according to our values as opposed to unconscious reactions. Exactly. So this is pretty hard to do, I would imagine. I'm thinking about today, a lot of impatience has been coming up, and I'm just wondering, how do people apply these practices in their busy lives, where it's difficult to just push everything aside, make that space to even acknowledge, okay, well, maybe I'm avoiding here, or maybe I'm overcompensating. Just even to have the awareness requires so much space. How do you suggest people go about identifying when they are reacting unconsciously, and then in that very moment, developing the ability to slow down?
That is such an excellent and ginormous question, Alexis. This is the work. This is the work of therapy. It can take a long time. But let me just say a couple of things about it, right? And maybe I'll just speak from personal experience, because that's what I often touch into. So for me, the test is always in the body. I've learned to track my state. I can tell if I'm feeling a bit numb or a bit dissociated. I can tell if I'm, feeling my own pain or my own emotions. And I guess we're always somewhere on the continuum between being really open and in our bodies and really kind of closed and a bit numb or dissociated. I see that as a continuum. And the body will tell you where you are on that continuum, from really shut down to really kind of open and relaxed.
Wow.
So yeah, I kind of want to see what my body's doing as well as my thoughts, whether they're racing really quickly and all over the place, or whether they're kind of more calm and clear and slow. Because when I'm calmer and clearer and slower and a bit more open, then I'm probably going to be able to notice when I've got an impulse or I'm in reactivity. Now, of course, we're all human, so we all have these reactive patterns and schemas that can hijack us at times. For me, to link this with nonviolent communication or needs-based communication, I always want to get into my emotions, because that'll take me to my needs. So if I'm feeling anxiety, or I'm feeling fear, or I'm feeling something like that, some pain, some emotional pain. I actually got a technique from Brene Brown once. Well, she talked about a client of hers who easily dissociated from pain, which is probably one of my tendencies, like a lot of people, is it's like, I don't want this pain. So something in me just kind of moves away from it. So her client said that she would say, pain, 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 in order to stay with the pain. I mean, not everybody would probably like that, but I like that because I want to stay with my own experience. If there's pain there, whatever that pain is, or discomfort, if I can, this is self-compassion, if I can be with myself in the discomfort and in the pain and breathe into that, then I've got a better chance of honoring my needs. So in the case of John in the blog post, he's got a legitimate need for self-worth and acceptance and belonging. And he's desperately looking for that from other people. But if he can slow down and honor his own needs for self-worth and acceptance and belonging and connection, then perhaps the urgency and desperation of those unmet needs, maybe that settles down a little bit. And maybe he can give some of that to himself. And maybe in that more self-empathic, relaxed place, maybe he relates a bit differently to people. And then maybe his relationships improve. And then maybe he experiences genuine connection and acceptance and belonging that doesn't come from desperate sort of a sense of deficit, but more from his heart, more from a sense of his full being. I don't know if that makes sense, but that's what I wanted to say.
Yeah, so more from an openness and essential self.
And vulnerability, because our schema is adapted in order to try and protect us so that we don't have to be open and too vulnerable. But now the work of therapy and the work of just human development, I suppose, is learning to be more vulnerable appropriately. And in our vulnerability, we are able to connect with ourselves and others.
That was a beautiful description of how a simple practice like slowing down helps to build self-awareness, build self-worth in this case, and ultimately then flow into our relationships. Thank you. That was a very coherent pathway.
Good.
It tells me that it takes commitment, though. It takes a real resilience and a mental strength to make that commitment to choose the path of self-compassion.
Yeah, it definitely does. I wonder, did you have another question, or should I read out the question we received on the
Go
Facebook
for it. No, that'll be perfect. We've covered good ground.
Yeah, great. Well, I'll read this anonymously as I promised, but this was a great message that I got from one of our followers. They said, due to our childhood schemas, such as bullying, being fat shamed, or constantly laughed at, which has led to extremely low self-worth and self-doubt, it seems to result in a lot of insecurity in the context of maintaining a relationship. Because you keep wondering, how could something good happen to me? And how could this person, my partner or whatever, not be fed up of me yet, honestly? And then you tend to look for signs that show you that they're fed up with you. You go looking for those signs and then acting on those, and you're preparing yourself for the worst. And in the meantime, preparing yourself for the worst, You forget to cherish what is present and what is amazing. That's the question. Isn't that a great question?
Well articulated. Yeah, spells out the whole sequence.
And this person who wrote this message really understands schemas, because schemas make you go looking for evidence of your existing beliefs. And then when you find evidence, because you almost always will when you go looking for it, then you're reacting to the thing you fear, which reinforces the thing you fear, and you miss out on all the goodness, all the ways in which, people are supporting you, people are loving you, people are caring about you. You miss all of that because your schema is making you look for threats and look, out of fear, and look for the negative. So this is absolutely, this person's articulated what a schema does in our lives. And I guess my answer to the question that you've asked is that, well, this is why we name schemas, despite the fact that I don't like the language. So this might be a mistrust or a defectiveness schema. So we're looking for all the ways in which, or abandoned, we're going to be abandoned, or that we're not good enough. As soon as you're conscious of that, stop yourself, slow down, pause, breathe, wait, and observe your mind, and know this is just an old belief, an old message, an old voice coming up. Slow yourself down, let those thoughts settle a little bit, and then connect with your body and your needs. You are allowed to want love and acceptance. It doesn't mean everyone's going to act the way you want them to, but begin with yourself. And maybe a mantra would help. I'm allowed to be me. It's safe to be me. I deserve love. I deserve kindness. We come up with these flashcards in schema therapy where we write sort of like mantras or affirmations. As long as they hit the heart, people keep them in their pockets. And when they're triggered, they pull them out from their therapy session and just say them over and over again to soothe themselves and start to rewrite or retrain the mind in a more compassionate way. So that's what I would suggest as a starting point.
It was interesting to hear her talk about difficulty with good feelings as well. I'm hearing this a little bit in my practice,
yes,
particularly with patients who have had traumatic childhoods, and the difficulty breathing into good feelings, feeling wanted, feeling pleasure, feeling joy.
Yeah. So true. So true. A lot of us got the message growing up that our needs didn't matter, or that we didn't deserve to have them fulfilled, and that there was something shameful in pleasure or joy or feeling, pleased with yourself. And so, yeah, it's hard for them to experience and take in empathy or success or love or even a compliment. You're right. It's very common, isn't it?
It is. And what's occurring as you're talking is what we spoke about last week of the practice of building tolerance, and that applies to our pain, as you were saying earlier. Pain. And the more I can just stay with it, the more I can expand my capacity to not have to react and just let it be there. And equally with feeling joy and liberation and freedom and being wanted and loved. Building the tolerance to those good feelings as well, I feel is as essential as the difficulty.
I agree. And I think what they have in common is they're all vulnerable states. So being joyful and feeling love opens you up, and it's a vulnerable state, as is fear or shame or hurt. These also, they're all vulnerable, all of these kind of emotions. And so it's tolerating vulnerability, isn't it?
Yes. Now we have 5 minutes, Dr. Rachel. How would you like to use the time? Are there any more questions in the comments?
There's one more question saying, what about being cheated on? You wait and you look for all the signs due to it being constantly the case. I mean, this is understandable, You know, when I've worked with people who've experienced betrayal, infidelity, dishonesty, whether it's in a marriage or sometimes a workplace situation or some friendship, of course, your mind is now going to be heightened and more vigilant, scanning for signs, evidence, threats. That's really understandable. And I always say this, you can't make a decision to trust. I mean, you may not have a mistrust schema in that situation. There may be just like a reality to the fact that trust is gone and it's going to take time and a lot of work to get it back. You can't just decide to trust. Trust happens when time goes by in a relationship I'm talking about, and the person, you know, does the thing and then they do the thing and consistently shows and demonstrates that you know, can rely on them in the way they've promised. You can't just make a decision to trust. Trust doesn't work like that. So it's a good question, but I don't think it necessarily indicates a schema, because, you know, there's reasons we lose trust or mistrust, but sometimes we lost trust earlier in life and now we generalize and we don't trust everybody, and that is a schema. If we start to generalize our experience from an earlier relationship across to other people, then we're looking at a schema. So my question to that person, it's just for them to reflect on, who asked that question in the comments, is, now, do you now find yourself mistrusting everyone? In that case, you've got a bit of a schema now, or is it just this one person? And in that case, that's pretty understandable.
Yes, I liked what you said earlier about separating from the thought or the story. I mean, as you're speaking, it's occurring to me that these stories and the schemas are kind of a confirmation bias.
Yes.
So of course, if this is my direct and immediate experience, that's how I'm going to be seeing the world. But if I can recognize that, it just allows me to separate just enough that I can see, okay, well, this is transient. It's not my fundamental self. It's not my basic makeup. It's a behavior, or it's a pattern, or it's a story.
Yes. Our schemas are our patterns and are our stories. And some of that's quite unconscious to us. And the thing I love about schema therapy is it's about making it conscious. It's about naming our stories and seeing our patterns and seeing how we overgeneralize, you know, from the past to the future and from one situation to another. And, you know, once we become conscious of all of that stuff, that's the crucial first step. Then we begin to have some choice around it. There's many techniques we use in schema therapy, like imagery work. We reimagine things. We rewrite our memories to get a different experience of our needs being met. We do empty chair work, where we say to the person what we really wished we could have said or could say. Bit of role playing. These are some of the techniques of schema therapy. I love it because it gets the unconscious stuff conscious. It gives people a voice. It helps them connect to their needs. And that's all I wanted to say about that. Yeah.
That is superb. We are almost out of time, but my final question to you, Dr. Rachel, is what piece of advice, if you had to bring it down to one practice that you would encourage our listeners at home to apply in their daily lives that might help them to become more conscious, as you say, of their schemas, what would you recommend?
You know, I think my answer to that question is the same answer I probably give you in many contexts, and that is self-compassion. Self-compassion. So being gentle and kind with yourself and patient with yourself. And to practice self-compassion, it always involves us slowing down, connecting with ourselves, and then being, you know, very gentle with ourselves. So that's the starting point, and it's essential.
So on that, shall we close with one square breathing cycle?
Could you talk us through that? That would be wonderful.
That would be my pleasure. Thank you. So you can check the needs of the body and either lower or close the eyes so that we can all breathe out together. And now together we can breathe in 2, 3, 4. And we can hold the breath in. 2, 3, 4. We can breathe out. 2, 3, 4. And we can hold the breath out. 2, 3, 4.
I always feel better after I do at least one of those.
Yeah, it does change things. Thank you so much, Dr. Rachel.
Yes, thank you so much for asking such fantastic questions. And do you want to just quickly tell people where you are right now?
Yes, I do. I'm on Stradbroke Island. I'm about to catch the sunset down at the beach because it's our retreat tomorrow. We kick off. So I'm looking forward to your arrival. And yeah, we have a small group here for 2 nights. And yeah, we'll be overlooking the water. It's looking like beautiful weather. And we'll be applying the practices of mindfulness and self-compassion, non-violent communication, and all of that supported by good food, clean sea air, and a beautiful bunch of people.
Yeah. I'm looking forward to joining you over there tomorrow morning.
Likewise. Thank you again, Dr. Rachel. I will see you tomorrow.
Okay, I look forward to it. And we'll see everybody hopefully again next Sunday on our Facebook Live.
Yes, and keep the comments and questions coming. They're really helpful.
They are. I'll check them again later. Okay, thanks, Alexis.
Thank you, everyone. Bye.
Bye.